Good morning. It's great to see you all. I'm State Representative Kim Schofield, serving Georgia House District 60. I am so excited about convening this dynamic group of legislators from across the U.S. to talk about menstrual equity, period poverty, and from our legislative lens. Truly, this deserves our attention and the legislation that will help women, upcoming women, address menstrual health, remove stigmas, and for the purposes in our space, policies such as eliminating the pink tax, toxin-free products, and free products, period products, and the list go on, and it will. Working in my district, I discovered that product access and affordability was keeping students from attending schools when they had their period. General knowledge about menstrual health was missing in the home, and due to the lack of in-depth health and sex education in our schools, I knew we had to do something. I partnered with Georgia STOMP, and STOMP stands for Stop Tax on Menstrual Products, and work with other advocates and other legislators to bring the Got You Covered Period Legislative Roundtable. Our moderator today is Claire Cox, chair of the statewide coalition, Georgia STOMP. Georgia STOMP was formed as a grassroots coalition of legislators and advocates in 2018, but is now a growing nonprofit of close to 30 organizations with a reach of more than 50,000 in the state. Claire, a Georgia native and Georgia Tech graduate, has co-led the successful effort since its inception, seeing progress made for funding in schools, access in prisons, and access following natural disasters in our state. Claire, I'm going to turn it over to you.
Thank you, and good morning, everyone. I welcome all of you from across the country. What an honor to be able to host and walk us through this event today. First of all, I want to say we're honored to have Congresswoman Meng join us. We are very grateful for her Menstrual Equity for All Act at the national level, which she introduced both in 2019 and again in 2021. We have Senator Janet Peterson from Iowa. Senator Peterson is an outspoken leader in Iowa for gender equity in the tax code and many other issues. We'll enjoy hearing from her. Senator Lauren Brook from Florida, her administrative assistant, Sean Lahaki, is here with us today. Senator Brook introduced the Learning with Dignity Act, mandating schools have period products available at no cost, and we look forward to hearing more about that. We also have Representative Julie von Haefen of North Carolina. Representative Haefen introduced a bill that, if passed, would eliminate the tax on menstrual products in North Carolina. And then we have Representative April Berg from Washington State. Representative Berg recently championed a bill that requires provision of free menstrual products in all public schools in her state. And then Representative Aimee Freeman from Louisiana. I bet Representative Freeman is still celebrating a win that her bill had recently and was signed into law when Louisiana eliminated sales tax on diapers and menstrual products. And we look forward to hearing about that successful effort. And then we are very grateful to have both Representative Sandra Scott and, of course, our host, Representative Kim Schofield here in Georgia. Both have been active in our state's work to eliminate sales tax, providing state funding for products in schools, and many other policy changes that we'll talk about today. And finally, we are very honored to have Phillip Vander, the Director of Government Affairs for the National Diaper Bank Network. I know him because Georgia STOMP works very closely with Alliance for Period Supplies, the Diaper Bank's initiative around period product need. So welcome, everyone. We have a lot of ground to cover, and so we want to hear from everyone, but ask everyone to please keep your answers concise, and we'll move through a lot of the issues that we want to cover this morning. I've done a little bit of giving intros on each of you, but for the first round of everybody, we'd really like to call on you and ask you to elaborate briefly about your efforts. In this round, I'm going to call on everyone individually. After that, we're going to do more popcorn fashion and have a conversation. But Congresswoman Meng, will you start us off and tell about your efforts at the national level, please?
Sure. Thank you, Claire. And I really want to thank Rep Schofield for convening all of us today. How exciting is this that we all get to work together? I know that everyone is doing great work in their individual states. I think we have Georgia, obviously, but including Washington, Iowa, North Carolina, Louisiana, and of course, New York. And, really honored to be here with all of you. And of course, thank you to Phillip. I know that all of us have probably worked with Phillip and his alliance in some capacity, and this is just a wonderful issue, and this is an issue that is, to me, a perfect example how the everyday person in our communities and districts can truly make a difference. I hadn't necessarily thought about this issue as a kid growing up and when I was running for Congress, but it was a young woman, a 7th grader in my county of Queens, New York, who raised this issue to me about how people in homeless shelters and schools were not able to obtain these products. And I found out that this was an issue that wasn't just affecting, people in underdeveloped countries, but right here at home in the United States, people were skipping school every month because they couldn't afford these products. We've worked in, various ways to get these products in our homeless shelters, in our federal prisons, in our New York City local schools. And now we're working and hoping to pass legislation on the federal level that would codify a lot of this, but would also provide, for example, for requiring Medicaid to cover these costs, directing large employers to provide these products, and selfish for all of our visitors in the Capitol to require all public federal buildings to provide these products as well. And so we're working on these issues and thrilled to be here with all of you. And thank you for all of your work.
Thank you. Let's hear next from Representative Julie Von Haefen.
Thanks, Claire. I'm excited to be here with all of you today. I'm Julie Von Haefen. I'm serving in my 2nd term in the North Carolina House. And the reason that this issue, or I became interested in this issue, is actually a book that hopefully many of you have read called Periods Gone Public by Jennifer Weiss-Wolf. And I came across that book in my 1st term here in the House, and it just really sparked my interest. I started reading more about this issue. And so, digging into it more here in North Carolina, I discovered that we are one of 28 states that still taxes menstrual products as quote unquote luxury items. And we all know they're not luxury items. They're essential items that should be non-taxable. And so that's why I filed the bill this session to, eliminate what we call the tampon tax or the sales tax here in North Carolina. And doing more research into just the fiscal numbers, we've discovered that it's 0.0007% of our state sales tax. And so you would think that this was a no-brainer, that it would help a lot of people, with period poverty, but it would just barely make a dent, in our revenue. But unfortunately, we're still fighting. And I'm excited to hear from some of the other legislators about their success in this area, because I want it to happen here. And so I'm happy to hear their stories and how they made it happen in their states. So thank you for inviting me today.
Let's turn to Representative April Berg.
Thank you so much, Claire. It's great to be here and see some of the amazing ending period poverty champions. So I'm Rep. April Berg. I am from the great state of Washington in the 44th district. I was able to get a bill passed this year with a lot of teamwork and team effort that really spoke to the heart of kind of post-pink tax. So we had already eliminated our pink tax, and then we wanted to have menstruation products available for all menstruating students, not only K-12, but also beyond. So this actually starts with 3rd grade in public and private schools. Products will have to be available in bathrooms. And that goes all the way up through community, technical, as well as our higher ed institutions. So the basic thought being that there should be no impediment with your period to receiving these products. That said, we actually cleaned up, as you know, bills like this kick around for a couple of years. We cleaned up all of the gendered language. So this is a gender neutral bill, and that was really important. So when I talk about period poverty and ending it and menstrual equity, I really talk about menstruating individuals. And one of the pieces that we were able to have in the bill was that this products will be available in gender neutral bathrooms. And if a gender neutral bathroom is not available, it must be available in at least one men's facility. And so I'm going to say that again, one men's facility. And that was a hard conversation to have with folks. And so, but I think it's really important that as we make strides, we make them together, a real community considered approach. And so this bill was able to actually pass pretty much bipartisan, it had bipartisan sponsorship and just about unanimous in both chambers.
Wonderful. Let's turn to Senator Jeanette Peterson.
Hi, everyone. Thanks for having me. And it's great to hear about your success, April, in Washington. I hope that we can have some success in Iowa as well. I've introduced a couple of pieces of legislation. One would be ending the tax on not only on period products, but also on diapers for children and adults. I was really shocked to learn from my fiscal note on the diaper portion of the bill, just how common diaper type products are for older Iowans in our state. Just the prevalence of the issue related to not taking care of women, in particular, women's health issues that aren't covered by insurance. That was one thing that I learned from getting the fiscal note back on that. Then I also have a bill that would require period products in all public buildings in our state, as well as school buildings. I think we had third grade as our starting grade level and have not had success in getting it even brought up for a subcommittee yet. I had someone from another party say it was silly that we were talking about this issue. So I still got a lot of work to do here in Iowa. So it's great to be on a call with all of you champions on the issue. And I still have faith that we're going to get it done in Iowa. Thanks, everyone.
Thank you. Let's turn to Florida with Senator Lauren Brooks, admin assistant Sean Lahaki.
Hi, everyone. So Senator Brook has been working on this issue now for a number of years, not only period poverty, but also the diaper tax issue, as Senator Peterson just referenced. So Senator Brook has filed the Learning with Dignity Act in previous years. Unfortunately, well, not unfortunately, but initially the bill was trying to get these products available in all women's bathrooms in Florida. But unfortunately, the fiscal impact of that was just deemed to be a little bit too high. So we've tried to scale that back down a little bit now, and we're going to make it so that they're available in usually in a nurse's office, but one location in every school, so that these products are available for all students, but you're just not going to be able to do it in the bathroom. You're going to have to visit the nurse's office most likely and get these products. Now, the diaper tax bill is something that she's been working on for, I think this is now her 5th session filing this legislation. And we are just looking to remove the sales tax on these diapers for adults and children, because like some of you have also referenced, this is not a big part of your state budget and your state sales tax. So it's really not consequential to remove this tax for many needy families. But yeah, thank you so much, and I'm really happy to hear what you guys are all working on as well.
Right, thank you. I'm going to turn to Georgia, and I'm going to call on Representative Sandra Scott.
Good morning. And again, thanks, Representative Schofield, for having this dynamic meeting. And I would like to say kudos to all of you all that have had legislation passed on dealing with period products. Here in Georgia, I will be introducing legislation probably on the same lines and basis with having period products throughout the state of Georgia in office buildings as well as in schools. But my thing is to put an end to period poverty. So what I do here in the state of Georgia is I collect feminine hygiene products and I distribute them out to the girls in my community and to all of the schools that are in my districts. That is how I am trying to help put it into period poverty, is bringing more people, making people more aware of the need here in the state of Georgia by collecting and passing out period poverty, period products to girls within my district, and get more coalitions to come on board, and they will be doing likewise to pass out period poverty products to girls. So that is where I am, and I do have legislation that I will be introducing this year.
Thank you.
Thank you.
Thank you. Let's hear a success story from Representative Aimee Freeman.
Thank you, Claire, and thank you, Keep It Moving, Representative Schofield, for inviting me this morning. I'm so glad I could join. I have to say my success story looms on others because I was newly elected in 2019, sworn in January of 2020. And my friend, former Senator J.P. Morrell, filed this legislation in 2017 and again in 2019. And we can only file fiscal bills on our fiscal sessions, which are on the odd years. And he's a personal friend, and he came. We have term limits in Louisiana, so not everybody knows that. So he had served his 3 terms, and our terms are 4 years. So when you hit 12, you can switch sides of the Capitol and go from Senate to House if you'd like. Very few people do that, but some do. But so I'm a first term freshman class, and I filed in 2020 a bill that allowed for a local option exemption so we could keep the conversation alive. And of course, COVID came, and suddenly a bunch of my and I'm a Republican state, Republican majority in both House and Senate, and I'm in the Democratic Party, so I'm in the minority. We do have a Democratic governor. And so that piece of legislation was a success, I believe, partially because of COVID, because what we allowed is a local option. So New Orleans, Shreveport, and East Baton Rouge all locally decided to exempt diapers and feminine products. And so that kept the conversation alive. And I give a lot of credit to my friend, former Senator J.P. Morrell, because he came up with that idea. He said, okay, I have a way we could file this and you could keep them talking about it. And as you all know, those of you who are continuing filing, you got to keep the conversation going. And so this year in 2020, HB 7, which 7th bill filed for my 2020 session, I had the conversation of let's do the statewide sales tax exemption, which had an $11 million fiscal note. And I noted that I think it was Representative Van Haefen who said it's a 0.0001%. Yes, that's what I would tell all my Republican colleagues. Do you know how much this is? And so I didn't need all of them. I just needed 53 of them on the House floor. And I think I ultimately got 62. And the Senate's a little bit easier to deal with. It's a smaller body. And the woman who carried it for me on the Senate is very well respected on that side and served, I think, 3 terms in the House. She's a Northern Democrat from the Shreveport area. And so even the ones who'd been there before in the Senate, even though they're term limited, there were some who served with Senator Morrell, so they knew the story. And I'm really pleased to say that, I mean, we were able to get it through to the governor's desk, signed. I mean, I can tell you that bill, every step of the way, someone tried to kill it. And every step of the way, I started an entire new negotiation. So it was not an easy journey. And I could write an entire novel on the pink tax exemption just from session 2020 and not even include the previous stuff that my friend, former Senator Morrell, did. But I'm really pleased about it. And I encourage conversations to continue. On this session coming up in 2022, I'll be filing a bill with one of my Democratic colleagues, I wanted a man on the bill with me. We're going to co-file something to fund period products in schools. And we may be adding the diapers in too. So I'm going the direction that you went, Representative Berg. And yeah, sometimes I don't celebrate the wins enough, Claire. You mentioned that. And I'm happy to be with a group of people who really understand the win, because sometimes people don't really understand what I did. And I don't even know if I do sometimes, but I'm really pleased to be part of this group. And thank you for having me here.
This is a group that understands what you did, so we appreciate it. Representative Schofield, before I turn to Phillip, Vander, Klay, do you want to comment any more on work here in Georgia and your part in that?
So yeah, just again, I'm just over the moon excited to hear what everyone is doing, and thank you that it's a tough climb, it's a heavy lift, but somebody's got to do it, and we are the group that's going to get this done. I've been working in Georgia. Again, we're trying to remove the tax. We also, to Representative Scott's point, looking at how do we include diapers and other legislation. I'd love to follow Aimee and what she's done, and I've had some conversation with April. So I think I'm going to be putting up some different type of legislation and trying to even get our men. So after I say that, then I'll toss it to Phillip, but trying to get our men to at least acknowledge you have mothers, wives, daughters. It's you've been asked to go to the store and buy the products. Come on, pull up your big drawers and let's get this done. Women deserve this, and this is the right thing to do at this time. So I'm going to be working continuously with Claire. We've got it done in the prison. We're still having some issues with the number of products that are being distributed in the Georgia prison system. And so we're starting slow. We're going to gain some momentum, and we're going to be at the finish line together. Every state. Thank you for being my example and my sheroes and heroes.
So before we open up to the next questions, Phillip, give us a little bit of an overview of your work and the work of Alliance for Period Supplies nationally.
Yeah, thanks so much, Claire. It's so awesome to be here with all of you. My name is Phillip Vander. I'm the Director of Policy and Government Affairs for the Alliance for Period Supplies. We have over 130 member programs who are distributing period products in their communities all across the country. And it's, the awesome part of my job is that I get to work with those members and all of your state legislatures and work with all of you to address this really important issue. And so, I mean, that's exactly all the issues that people have highlighted today, repealing the sales tax to make products more affordable, to highlight that this is really also an equity issue, right? Like that they shouldn't be taxed. So let's stop doing that, right? We need to increase access and to increase access in schools. And there have been some really amazing legislative wins this year, some that you all have mentioned. There was in California a big bill to provide period products in schools. There's actually a bill, and this is to Representative Schofield's point, in Michigan that would repeal the sales tax on period products. And so there's two bills that are moving together, and one of them is authored by a male representative. And so, and he's a Republican who's kind of new to this issue, but so much of our work, and I know we've all been doing this, is the educating people, raising awareness about the issue, because once people start to get it and they're like, oh yeah, this is an issue for everyone, this is an issue for all of us to work on together and move forward together on. And so it's really exciting to be a part of this, to see all of the progress that's happening across the country, and to keep moving forward with all of you.
Thank you. So from this point on, I want to encourage some cross conversation between all of you. I'm going to ask some starter questions, and I'll interject if I think we need to move along, but feel free to raise your virtual hand or ask each other questions or whatever. We've heard some successes. We've also heard some difficulties. I want to hear specifically now, kind of let's look at what the barriers that you have run into in your work. What are some of the arguments? What are some of the problems? What are some of the issues or barriers to this work? And it's open here.
I'll start, and maybe I could ask Representative Freeman, because we're serving in similar bodies. I serve in the minority party with Republican House and Senate and a Democratic governor. So I think like my big obstacle has honestly been getting that bipartisan support. And I think when I approach, I've been really working on approaching Republican women and saying, like, this is not, a partisan issue. This is just, a simple equity issue, and trying to frame it so it's not a social issue that they look at as like something that Democrats are trying to push. And so I was wondering if Representative Freeman could address, how did she gain that bipartisan support? And was there something that she said, or like an economic argument, or what was it that kind of got them to agree with your bill?
So I can tell you that the coalition we built was critical, and Phillip can attest to this. We had, his organization and others nationally, but then we also had the Louisiana Right to Life. I'm a pro-choice Democrat, but there are a lot of life Democrats that serve with me. So the combination of the diapers and the feminine products was critical. And former Senator JP Morrell told me that. The other thing that I found very interesting, because it was the first time a woman was carrying the bill, right? They would say certain things to my friend who was a senator, to him, that they wouldn't say to me, right? Because it was a woman carrying the bill. So a couple of my Republican colleagues, their daughters were like, Dad, if you don't vote for this bill. So I had daughters advocating. I had one daughter who made an entire PowerPoint. She's got two other sisters. The daughter happens to live in Orleans Parish. The representative is in a rural area. His daughter made him a PowerPoint that she put on Instagram. So I'd say, speaking to their daughters and their wives is actually a good thing at this point. And I did have several of my Republican women colleagues who came on board with me, but it took a lot of individual conversations and a lot of conversations, with me, especially with the Republicans who would say they didn't want it. I'm like, well, look at all these tax exemptions you have for all the corporations. Let's add those up. And you're telling me 11 million is too much? So the one-on-one conversations, and then I must say I had the speaker. If I did not have the speaker with me, I would not have gotten that bill off the floor. So, it's all a negotiation. I had to help him on a few things where he needed some Democrats to get my bill moving. But it started all over on the Senate side. I mean, a bunch of them thought it was going to get killed over there, and they tried, believe me. And so I think those individual conversations were a huge part of my success.
Congresswoman.
Yeah. If I could also add, I think that even though it's really easy we shouldn't just assume that this issue is just a Democratic issue. I think that there are opportunities. I think some people signed on to my bill just because they wanted me to stop talking about periods on the House floor, which I'll take. But when we had passed something through a larger package to allow these products to be purchased with people's flexible health spending accounts, we actually worked with a Republican member at the time, Lynn Jenkins. And so if that is ever a helpful talking point, she doesn't serve in Congress anymore, but it is, at the time, we billed it as a bipartisan issue, and she was very instrumental in making that happen. So feel free, to highlight that example. I will also say that locally, some groups and leaders in the community have expressed interest in this issue. They could be like religious institutions or houses of worship, because many of them run homeless shelters or food pantry or, other charitable type activities. And they can see firsthand that these are products that are in high demand. So maybe working with some of those leaders and groups to get them to weigh in with other colleagues may be helpful as well.
Anybody else, barriers you've run into? We sort of touched on it, but I'm still going to ask the question specifically if it gets your juices flowing. What have you done that worked? We've mentioned some of the items. Don't assume it's a Dem bill, working across the aisle, some other ideas of what's worked.
Can I just add to what Congresswoman Meng said, that the guys are uncomfortable, make them uncomfortable. It's okay to make them uncomfortable. That helps.
I know here in Georgia, we've had leadership specifically say to us, this is almost a quote, "This was difficult when we first started talking, but the more I hear from my constituents, the more I know this is an important issue." And to us, particularly who this came from, it was a huge change because of education. So it does, keep having like you said, keep having the conversations. Any other?
Well, I was just going to jump in. Our bill, one of the differences, I think, is that we did not have a fiscal note, a traditional fiscal note. We actually asked the school districts to provide these products, much as they do toilet paper. And that was our talking point, right? That was our talking point. This is toilet paper. At what point do you open up a school building with a restroom with no toilet paper? Well, of course, there's a fiscal component to that. But part of kind of overcoming that barrier was getting I would say, buy-in and really talking through the issues with your local school board directors. Because it's not, for us, it didn't become a school board issue, but it was going to be a building issue. So much as they fund the building, so your principal has that budget's going to now have to include a little more for your restroom supplies. Because again, this is just like toilet paper. So there was a little bit of pushback, but we did a great job of engaging youth and them coming up with some great stories, anecdotes, and actual numbers as to how this is not a financial barrier, and how once you take away those really bulky machines that take quarters and you go to more of a nice, slick acrylic, just more use-based system, it was, went from thousands of dollars to not even hundreds of dollars just to have that simple, basic acrylic installed. And so we've got a picture of one that just came in this week that is just lovely. But we're also talking the smaller districts, because we do have 295 districts in our state. So we do definitely have smaller ones that are going to run into some financial barriers. And we're hoping that I might hit up Phillip later for the Alliance for Period Supplies, because I've been trying to get some partners in on just small dollars, looking to see where those are to get these schools what they need. But the other barrier too is just that thought barrier of these, menstruating individuals will start grabbing products, stuff in their pockets. And there was actually one of my Republican colleagues in the other chamber who really put that myth to bed on her floor speech, where she said something to the effect of, "These are not the Cadillac of products, gentlemen. These are not the products that women are going to be fighting over. These are to get you from point A to point B." And she did it in such an eloquent way that I think some light bulbs went off to say, okay, that piece is not going to be a problem as well.
There are a couple ways that we talk about this, I think, in people, and again, just like you all are saying, right, the educating people, the raising awareness, the getting past that initial level of discomfort talking about this issue that for too long people just didn't talk about in legislative chambers and in committee hearings, and now we are, which is awesome. But really highlighting this is tax reform for families, right? This just helps a family get by and get the products that they need to live, to survive, to thrive, to go to work, to go to school, which then makes it both an economic and educational success issue, right? This is how we can prepare our communities better. This is how we can move our economies and our students forward, make sure that people are fully participating in our economy, in our society, in our schools. And so that's just so important. It's this small change, right? This really isn't, in terms of the grand scheme of budgets and the billions of dollars and everything that are out there, can make a huge difference in the students who are attending school, making sure they're not missing, that there aren't absentees, the people who can go to work. We address these issues, and it's just good for all of us and as a whole.
I know here in Georgia that we were not able to engage leadership on the tax elimination issue because they said it was such a small amount of money that went to people that didn't need it or whatever, but we were able to get their attention related to products in schools. And so funding was then put in the budget. They basically said, don't agree with you on tax elimination, but we hear you on the period poverty issue, sort of what Phillip talked about earlier, not agreeing maybe on the equity issue, but here in the period poverty issue. I'm kind of curious about, and this may be a personal question, but I'm kind of curious about your thoughts about and it was Representative Berg, I think, that mentioned about the idea of kind of requiring products in schools or doing that as a mandate, versus in Georgia, we've gone a different route and are actually funding products in schools, but it's not mandated. So it's not for enough money to pay for everybody. But I kind of wonder in the environment of the schools and school budgets and all, just some thoughts on that, because it's something we struggle with here in Georgia about the path that we've taken, even though we've got $1.25 million that we got put in the state budget to buy period products in schools, but that doesn't provide all those schools with them. Anyway, any feedback, any questions? That's kind of a personal, not personal, but a curiosity question on my part.
I kind of thought the same thing, Claire. I mean, at least for me, I've worked in public education, and to put an unfunded mandate on our schools, I always am very reluctant to do that, because we talk a lot about the fact that a Republican-led legislature does that, and we very much fight against it because they tend to pass a lot of policy that, you know, they say, we need you to do this, but we're not going to give you any money to do it. And then it creates kind of a chaos situation, at least here. And so I would be reluctant to do that myself, but it sounds like it was successful in Washington. I mean, we're kind of in a budgetary crisis right now with our schools. So I would just avoid doing that, at least here in our state and the way that our dynamics are at this point.
And I would just chime in. I think because I 100% agree, and I, full disclosure, I'm a current school board director as well as a state legislator. So I am completely against unfunded mandates for our schools. But I will say I had folks reach out to me to thank me for this law because it gave them the ability to do what they already wanted to do. I think when you really start unpacking the fiscal numbers, and it's great, give me a huge fiscal number and okay, let's start digging in. And what I found was there were just a lot of false assumptions, right? So there was a false assumption about the type of machine you would need. Now, as we know, most of our ladies' rooms already have these machines. So you're not talking about retrofitting anything. You're literally talking about a very inexpensive, now free product that honestly, depending on how they're supplying and their procurement looks, is so close to the amount they spend on toilet paper. And not to, this is again to the Congresswoman's point about talking about menstruation on the floor. Here's where we go. What do we do when we don't have that product for free? We ball up toilet paper. I mean, let's just be real. And there's a cost to that, right? So we're basically putting a cost onto our schools that they don't even know or think about. Instead of doing it with dignity for our young menstruating individuals, we're doing it by hook and by crook. So I think when you really start breaking out those fiscal notes, talking about the reality of the situation, last thing, the most passionate piece of testimony we had was from a young woman who sat through a high stakes test. Her flow came, she did have the means to pay for it, but because it was a high stakes test, they said, you cannot access your backpack. So at that point, she had one of two options: to sit in her current situation and try and concentrate on the high stakes test, or go and make something in the bathroom. And both really bad options, but both had a huge cost emotionally to her and a potential fiscal cost to that institution. So really talking through with your young people about what's going on right now, because I'll tell you what, your schools are already paying for it.
That's a great point.
Can I ask a quick follow-up, Claire?
Sure.
How did you get the information about how much it would cost each school? I mean, is that something the schools put together, or?
That's a good question. So yeah, the schools do. So in our state, so especially for our higher ed, they came in with these fiscal numbers and wrap rates that were just a little bit not what I thought to be the case. But what we did do was talk with schools that were already providing it for free. So a lot of our higher ed, because again, they had already done the math and they said, look, it's cheaper to give these away than to try and collect 25 cents and so on and so forth. So some of those numbers came from lived experience of schools already giving them away from free, and then other ones came from unpacking the notes to see what they thought the cost was going to be. And literally, like today, we're about to source some of these acrylic machines because now we have a vision of what they look like. And again, I'm happy to share that picture. It is just so stinking simple. You have no idea. And it has a little thing for tampons, a little thing to grab pads. I mean, it's got to be, I don't know, $50 worth of plastic. And you mount it to a wall and you keep that thing refilled. And you keep it moving, and that's going to be cheaper, more than likely, for your districts than going out trying to figure out these ginormous machines that, again, they already have anyway. So there's that.
Great discussion. Let's turn just a minute and since we have Congresswoman Grace Meng, and talk about what can be done at the federal level and what can be done at the state level, and kind of have that conversation.
Sure. Well, so on the federal level, and first I want to address Janet's question in the chat on how we engage kids in work which kind of ties into what we're talking about in your question. But one of my favorite parts about working on this issue unexpectedly is that it's been relatively easy to engage young people in this work. They are so interested, and this is something where, you don't have to have a political science degree, you don't have to be in a powerful position. We've literally worked with our youth, writing postcards, making phone calls, sending an email to either a school district or to other elected officials to get them to support our various pieces of legislation. And so that's been really exciting. We've, engaged in Zoom chats and group meetings before COVID. And so it's been really fun and really exciting. On the federal level, something that we could use more help on is to get more co-sponsors on our legislation. We have a bill at the federal level, menstrual equity for all, and basically comprehensive, what we talked about earlier, and just trying to get more co-sponsors in different states. And that's why I'm so appreciative of having this Zoom with all of you so that we can learn more about what everyone's doing in their individual states. And then just by having these conversations, of course, with stakeholders like we are today, but even with and through groups that might not traditionally be a part of these conversations, raising awareness, finding opportunities to help inform folks what's going on is really helpful in helping us to normalize the conversations around this topic.
Let me jump in as well. And thank you, Congresswoman Meng. These students are starving and ready to talk about the issues. Part of the this whole week-long focus was generated by some of the students that I have as interns. They are high school and college students that said, hey, we want to do a period poverty focus week. And so they're starting period clubs, and they come from, I have students that are working with me from a couple of different states, Florida, Texas, Louisiana, and this was their baby. So tomorrow we'll be doing an Instagram live. Wednesday we're doing a Facebook live, and then Thursday we're doing candid conversations. Similar to what the Congresswoman has said, we're opening up and people are telling their stories. The students have gotten and put on Facebook and created a platform where they're collecting stories of what's it like. And so I think if we just start engaging, I think our next step is postcards, writing postcards. And then I'd absolutely love to talk with some of our legislative men, and especially their women and their daughters, to get that buy-in. So I think it's just a holistic approach, but college students, high school students, your family members are ready to talk with the schools. And this dialogue, again, I think we have a great opportunity because this is our moment to support the congressional menstrual equity for all bill and get our folks to be on, to co-sponsor and support this. But on the state level, and I love the fact that Claire's going to disagree with me, but here in Georgia, it's time to make the men a little bit more uncomfortable.
I don't disagree. They don't like to see me come up there under the gold dome. All right, so with maybe these two next questions that I've got kind of go together, but what needs to happen next? And are there ways we can collectively work together?
I'll just add that I think this kind of event that Representative Schofield put together is a great way for us to collaborate. So I think the more we can do things like this and, reach out to our colleagues. I mean, I met Representative Schofield because she called me out of the blue because she saw that my bill passed. So we became friends even before we met in person at Women in Government conference this year. And I must say, like, it's very helpful to hear some of your ideas and to know what is next and how we can help each other. I mean, I think, and these kids, the interns I have from universities locally and some of the high schools, they're running the show, and I love them for that, and I'm a mom of 4 kids, and my kids are grown now, but I'm always encouraging that. And so that makes me want to do more when we get them involved.
What are some other ways we can work collectively together?
Well, one of the things that I've also learned is how little period and perimenopause and menopause are covered with Medicaid and Medicare, and the frustration with the kind of sexism, even within government-run healthcare. And it's impacting the number of women, and particularly women of color, having hysterectomies at an age too early that impacts them for the rest of their lives. Another issue we're seeing in Iowa is not letting women know the rate of C-sections in hospitals and other issues that go on to cause some pretty significant reproductive health care issues for women beyond their pregnancy years. So I think that's another avenue that we need to start addressing, some of the care needed for women from the time they're girls and the pregnancy years all the way through perimenopause and menopause, that we're just not seeing equitable care.
I agree with you 100%, Janet. We have some amazing opportunities. Just want to pivot and ask a question about how do we now work with some of our manufacturers, and with this whole messaging in the media. They're still not ready to deal with actually how do we talk about periods in the media. We need to change that narrative. That's what I heard from my students. There's still, again, some of the TV commercials and the advertising. We need to really bring those folks to the table to have these kind of conversations on what we need to see to really embrace the whole movement of equity across the board.
I think they're referring to all the euphemisms and the blue dye and the different things that we see in the media.
Has anybody received any information about a pretty significant tampon brand being taken off of the market? I was just curious about that. As someone had mentioned toxic products, if that has anything to do with it.
I can share my experience. Specifically, we have another piece of legislation that talks about proper labeling of chemicals and ingredients that are actually in these products that we literally put inside our bodies, more so than even like a lotion or a shampoo. It's not easy. I will say that this is a work in progress, but we have brought some of our manufacturers to the table. I'm always happy to share our experiences with you, maybe offline, on which manufacturers might be more receptive. I don't want to say we're successful, because we're not there yet. We're still in the midst of having these conversations, but they know we have legislation, and they know that people deserve to know what they're putting inside their bodies.
Let me say that in one of my counties, they do not allow Tampax in their schools because of toxic shock. So they're more comfortable with giving girl the pass. They say now a teacher can give a girl a tampon, but as far as their nurses in their schools, they only collect pads because due to toxic shock with girls wearing the tampons too long, and they don't understand and not changing them out regular, that toxic shock is one of the key issues and problems that they see in the girls from wearing the tampons. So, all of that comes with education, educating the child on how often they should change and all of that. I really think the kids need to be educated in the schools about how to wear and the cleanliness and how to keep their bodies cleansed when they come on their cycles. We know that's something that parents should be discussing with their kids, but it is not something that is being done. And because we know that this could lead to a lot of feminine problems for a woman was just doing the basic and taking care of her body. So the toxic shock is something that the high schools in my area are concerned with when it comes to the tampons.
Well, y'all moved into my last question, which was what is not yet talked about in the menstrual equity space. We've talked about access in schools and needing access. Now we're talking about labeling and all. Are there other issues as we look towards closing out here? Are there other issues that we need to move into in this space? What policy changes would move us towards menstrual equity?
I think for me, it's digging into the Department of Corrections. In our state, and I think a lot of states, the laws, the quote unquote laws, are that these are free products and so on and so forth. But I think when you look at what's actually happening potentially, and of course I'm just caveating all of this, but potentially what's happening in some of our correctional facilities for women and menstruating individuals, that they are not really getting the access that we as lawmakers think we've provided. And so I'm just leaving it there. I know every state's in a different position, but I want to ensure that the policies that we think we've prescribed for this issue in our prisons and jails are actually being fulfilled. And if not, what's the legislative nexus for us to make those policies stronger, or of course, in some states, create them to begin with?
I was going to say, thank you for mentioning that, because I was going to say we just passed a bill miraculously right here in North Carolina this session to provide free products for prisoners, which has never been happened before here in our state. And it was actually just kind of stuck into another bill and got absolutely no mention, which is probably a good thing, because it, was able to get through on an actually a lot more controversial bill around shackling pregnant people during labor, pregnant prisoners while they're in labor. And so it was stuck in there. And so I'm really glad to hear you bring that up to make sure that it's actually being done and it's actually being done right. Because I was just happy that it was done. But like you said, I think that, there could be implications, in the future about whether it's actually successful.
Yeah, Representative Berg, we've tried to work either with our state here at home or federally on getting written guidance. We're asking to see their policy and their regulations on how the law is being implemented, because you're absolutely right. We had sort of heard through the grapevine that even though it was codified that these products were to be provided in our federal institutions, that it really wasn't being implemented in the way that we intended and in an effective way.
That's something we're looking at here in Georgia, because following on the federal act where products were supposed to be provided in all Federal Bureau of Prison facilities, the Georgia Department of Corrections put in place a policy that they would be provided here free on an as needed basis, and put in some wonderful cabinets in women's dorms. They are only in the women's dorms, but we've gotten some reports that now, the cabinets aren't being kept full. So they've got where they had a quota for women before and they could only get a certain number of products. Now there's kind of a quota for the cabinets versus them, and trying to get that information and look at it. And also just all of the local and county jails. Georgia has 159 counties. We don't have 159 jails, but all of those local and county jails, the provision of products in those is a real concern and a real issue. Well, we are. Go ahead.
I was just going to add that as a newly elected legislator, in my first term, one of the biggest things I've learned is that we can pass these laws, but the follow-up is key from the advocates and from us. So, I mean, you can't just assume it's being done. And I've learned that the hard way on a couple of things that I've worked on. So I'm going to keep my eye on this pink tax in Louisiana for sure.
Yeah, that's a good point. I think we're going to honor that we're at the point of an hour. Representative Schofield, do you briefly want to mention again about the data collection that you're doing? And then I'm going to give a plug for Candid Conversation on Thursday night, and we will close this out.
Yeah, again, thank you, everyone. And one of the things that we are really working hard here in Georgia is to make sure that we have the data within our school system on the number of issues that are relating to sex education, health education, menstrual education. We've got to be able to put the numbers behind the legislation that we're doing. So we've been working with some key universities to do data collection in the school system and in the university setting. I'd be happy to share offline how we're making it work and how we hope to use this data. But again, thank you. I have a term here that I'm trying to put in here. It's called OATH, O-A-T-H, oversight, accountability, transparency, and honesty. When we all are writing this legislation, I think someone said it, we've got to make sure that we're just not dropping legislation, but we follow it through, that there is oversight, accountability, transparency, and honesty when we're moving forward. And I think this is a great way. This is the one of the times where we're coming together, both on a federal and state level, cross party lines, to say, we've got to get this done and we've got to make sure it's enforced. Thank you, Claire.
Yeah, and I'm going to close with Representative Schofield mentioned this, but on Thursday night, she is hosting, we are co-hosting a candid conversation. These are conversations that Georgia Stomp has started having across the state with different groups. A group of women legislators recently participated in that, and they are lighthearted and engaging discussions about our collective lived experiences with menstruation. But they are one of the best tools that we have found to lift the stigma and shame around menstruation and have women particularly, and those who bleed, to just feel more comfortable talking about some of these issues and bring awareness to period poverty. Some of the things that y'all mentioned today are covered in it. If you are anybody listening to this, or any of our representatives would like to join one of these and see what they're like on Thursday night, you can email right now georgiastomp@gmail.com, and I'll send you the Zoom link to get into that. Our junior leagues in the Atlanta and Douglas County area in Georgia envisioned this program, and we've now had about 6 or 8 of them, and it's growing. So would love you to join us for that. It's one of the best things we've found to equip advocates to be more comfortable speaking about this subject. Thank you all for joining us today. Thank you, Representative Schofield, for hosting this and allowing me to moderate, and we will continue to work together as we go forward.
Thanks, everyone.
Thank you.
Everyone.
Thank you, everyone.